Speaking at a press briefing on Saturday, the national chairperson of the CPP, Nana Akosua-Frimpong, said the purpose of strict adherence to the safety protocols at institutions will be defeated if the public transport sector is not adhering to the protocols. She argues that it makes no sense to sit in a trotro or taxi without practicing social distancing or wearing a nose mask, only to wash your hands and sanitize when one reaches their destination.
When the first shutdown came, we CPP went around after we came back to look at what was happening and who was absorbing the cost of the owners, the car owners, the church owners, the taxi owners, and the drivers themselves. And we realized that the extent of sacrifice they did. I can understand that maybe that is the reason why, in as much as they themselves are wearing the mask, they can't afford to say we are going to take 3 or 2 or do the spacing like they were asked to do. So please, Mr. President, you must have to come again and ask them to do that. The cars, the trotro drivers, the taxis are still as crowded and the protocol is not being observed.
She says government must prepare to support public transport stakeholders when the strict measures are reintroduced, adding this can best be achieved after broad consultations with the Ghana Private Road Transport Union.
We went around and we found out that during that period, it was a difficult hardship on taxi drivers and car owners. Some of them, if not all of them, have to do sales. And some of the car owners also have to pay to the banks and other institutions that have financed the vehicles for them. So if they won't voluntarily say that they are taking 3 people or just 2 people, when the sale is still the same, government, we are asking you to intervene. As a concerned and loving nation, we must absorb this problem as a nation.
There were concerns raised about a lax in the country's contact tracing efforts. The CPP chair believes that intensifying contact tracing will boost Ghana's fight against the virus.
We don't see the initially, when somebody was found with COVID or a group was found with COVID, there was a follow-up, which was contact tracing. I know personally people who have gone to hospital and they have COVID and are expecting to either get a call or something, and nobody has called me. We are asking government to immediately put the contact tracing in place again. Whatever they did before, that Ghana became one of the best in the world, and we got recognition. And please, this virus, as we all know today, is more deadly and is deadlier than before. And I think that we don't even know, based on the mutations and things, we don't really know what to expect next. So whatever you did right, government, as people always say, why change something that is working? If something works, why change it?